In this video we're going to talk about our breath, and we're going to focus on what happens in our body every time we breathe. Do you realize how many times you breathe per day, per hour, per minute, or per second? It's something we do all day long, unconsciously and automatically, and thanks to that we're living, but we don't really realize what happens to our body every time we breathe. So let's take a deep inhale together from the nose. Hold. Feel your heart beating. And exhale. What happened just now? Every time we inhale, there's a lot of oxygen that comes in our lungs, where the exchange of oxygen and carbon dioxide happens on the red cells in the blood, and then the blood can take all this new oxygen to all the tissues and cells and nourish them and let them create energy, and then expel all this garbage, carbon dioxide, that we don't need to anymore. It's good to also realize that with every breath you're taking, you're permitting to all your cells and muscles and organs and tissues to produce energy, and you're clearing them out. Great. Let's do it again. Let's inhale all together from the nose. Hold the breath. Feel the heart beating. And exhale. And once again, visualizing all this air and oxygen going in our cells, in everywhere in our body. Hold. Exhale. Now, do you notice any difference in your body? Maybe your heart is beating faster. This is because we just activated a lot the system that accelerates the heartbeat. This is what we call the sympathetic nervous system, and we'll come back to it later. Now I would like to invite you to put your hands on your chest and your belly, and inhale deeply. Let's count to 3 or 4 seconds from the nose. And exhale from the nose again in the same amount of time, 3 or 4 seconds. And we will keep doing this. Inhale deeply through the nose. Exhale completely through the nose. And 2 more times. Inhale deeply. Exhale completely. And again, inhale through the nose deeply and observe how your hands are moving and the chest and belly. Are they going out or in? And exhale when you need to, again observe your hands. You can relax your hands, relax your breath, and let's see. Do the chest and belly move? And I'm quite sure they do, but in what direction? Normally every time we inhale, the chest expands so that the lungs get full. And with the expansion of the chest, another muscle very important in breathing, the diaphragm, which is like a hammock, separating the lungs, the thoracic part from the abdominal part, should go down like a hammock to let space to the lungs to expand, to the air to come in. So as the diaphragm comes down, the belly, the abdominal area, gently expands as well. Did you notice that? Or was it the other way around? Because oftentimes as we inhale, we tend to do this, and we inhale, we put the belly in, and expand the chest. Let's try it once again with this awareness and observe. Okay, hands on the chest and belly, and inhale. Exhale. What happened? Let's do it once again and consciously expand the belly as you inhale. Push your hand, your right hand, if you have your right hand on your belly, push it out. And then consciously also, as you exhale, exhale and pull the navel in so that you chase all the air out. And try it once again. Inhale. Exhale. Belly button in and out to chase all the air out. What just happened? When the belly expands, the diaphragm comes down and you have more space, so you can go for a deeper breath, longer breath. And as you exhale, you pull the belly in and you push the diaphragm up, so it helps you exhale completely all the air out. So prolongating even more your breath. And this is what makes your breath longer. The longer your breath, the more stable your mind. The longer your breath, the less anxiety you will feel. And that's a very quick and easy tip. Every time you feel anxious or restlessness, just to stop. And for 1 minute, just 1 minute, elongate your breath so that you breathe 5 or maximum 6 times per minute. Give it a try. Now, what else happens in our body every time we breathe? And let's inhale in 3 seconds. Hold. And exhale in 6 seconds. Hold. Inhale in 3 seconds. Hold. Exhale in 6 seconds. Hold. And last time, inhale 3 seconds. Hold. Exhale in 6 seconds. Hold and relax. And inhale, let the air come in and out naturally now. How are you feeling? How is your heart beating? Do you remember in the beginning of this video, we inhale, we hold our breath, and then exhale quickly, and then the heart started beating faster. Did you notice that? Now I bet that your heart is beating less fast. Actually, what happens every time we inhale and every time we exhale, the rhythm of our heartbeat changes. Every time we inhale, the heart beats fast. Every time we exhale, the heart beats slower. Isn't this wonderful? And why does this happen? Because the heart is controlled by 2 systems, 2 nerve systems called the sympathetic and the parasympathetic nervous system. The one accelerates the heart and the other one slows down the heart. So let's imagine our body like a house, our house body, and these 2 systems are like the infrastructure of electricity cables and water pipes. So electricity cables, let's imagine them red, and water pipes, let's imagine them blue. They arrive everywhere, in every room of the house, or every room that needs water, if you wish for the water supply. And they are there everywhere to help function the house. That's what happens in our body as well. So the nerves come on all parts of our body, innervating either to activate or to slow down different functions so that the body can function properly. Now the red system, let's imagine this electricity system, is every time you activate yourself in an emergency, whether it is a bus that you see and you need to catch it, you activate the system very strongly, adrenaline comes out, the heart starts beating very, very fast, and the cells are ready to consume a lot of energy so that you run fast. And the same thing happens when you are at work and you need to be very focused, or you have an exam or an experiment that you need to do, or an interview. You're in this very focused, alert, adrenaline out moment, and very precise. And that's where this red system, the sympathetic system, is very, very, very active. And that's wonderful. But when this emergency passes, once you have catched your bus, there is no reason to be running anymore, to have adrenaline in the system. So normally the system needs to slow down, deactivate. And when this system deactivates, then the water blue system, parasympathetic system, activates, so that they maintain a balance. And that's the proper function of the body. And then when you need to activate again, the water, the blue system deactivates, and the red system, the electricity system, activates again. And why am I talking about all this? Because these are exactly the two systems that control the heart through our breath. So every time I inhale, I activate my electricity red system, sympathetic nervous system, and my heartbeat goes faster. And every time I exhale, I change this balance. And then this blue system, water supply, calm system, parasympathetic system is active, and my heart beats slower. What happens in our everyday life, where everything goes fast and we're always in an activity mode, this system is very high, and our breath is very short and very fast. So basically the heart remains in a very, very strong and very fast pace. And then when you need to go in this state, for instance, when you want to go to bed, where you need to have a very relaxed state, and heart's very relaxed, the mind very relaxed, so that you can fall asleep, it's difficult to do so, because instead of being here, you're here. Without talking more and more about that, I will go directly into the breath we can use to counterbalance this. Is this breath that we did, like 3 seconds inhale, 6 seconds exhale, or longer if you can, or shorter if you can, if it's better for you. But the important thing is that the exhale is double time of the inhale, so that you activate more the water supply, so that you calm down your heart, and also you counteract this permanent high activity of the sympathetic system, of the electricity system. So let's do it once again together. I like to put my hands on my heart so that my awareness and my attention is on my heartbeat. Let's inhale in 3 seconds and exhale 6 seconds from the nose. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. 2 more times. Inhale, exhale, inhale, exhale. Relax your hands, open your eyes, and let the air flow in and out naturally from the nose, and just observe. So I let you, with these 3 breaths, First breath, we activate the heart very quickly. Inhale deeply, hold and exhale quickly. Then you can have this balanced breath, 4 seconds inhale, 4 seconds exhale. Mind the belly, that it comes out when you inhale. And then you can have this calming breath, 3 seconds inhale, 6 seconds exhale. Double the exhale. And I hope this serves you and helps you in your everyday life.